This presentation is prepared by Samina Khalid as part of HAP 789 course, a Pre-Capstone Professional Development Seminar for George Mason University Department of Health Administration and Policy. For HAP 790, I have decided to do a capstone practicum. My site will be Innova Shore Cancer Institute. After years of planning, it opened its doors about a year ago, and, and it's a one-stop shop for cancer care in DMV area. Uh, After its 1 year anniversary, the management at the cancer center decided to develop a new clinic, which will be called High Risk Cancer Clinic. The goal of the clinic is to identify patients who do not have cancer diagnosis yet, but are considered high risk to develop cancer in future. And the goal is to provide early intervention and options for them how to minimize their risk or how to give them early treatment so they can have better outcomes. I will be working with one of the project managers who's working on this clinic along with the CEO of the cancer center. There are two steps of my practicum. The first step is to analyze the data that's already available from lung and breast cancer clinics. What's happening right now is that to identify high risk patients is not a standard practice within all the clinics at the cancer center. Currently, breast cancer clinic is doing some of its work on its own. The only standard practice they have is developed at the lung cancer clinic where they provide genetic testing to the patients who are referred by primary care providers. Uh, so in the first step, I will be analyzing data from the lung and the breast cancer clinic and kind of find out why those patients were referred, what were the diagnosis code uh, that before they were ever seen at any of these clinics, and kind of present that patient population uh, and identify those variables uh, that clinicians considered that these patients were high risk and need to be seen by the breast or lung oncologist. Uh, the second step of the project will be to study or rather extract the data from 10 primary care practices within Innova, um, and clean that data, analyze it, and to identify the patients who fall within the high risk population. Now, initially, they're trying to do this. They're trying to identify population for lung cancer, breast cancer, and add on GU/GI cancer. I will be assisting with that second step to identify those data. Now, to uh, what qualifies a patient with what identifies a patient as a high risk is a predefined criteria that will be provided by the clinicians, and I will be part of those meetings, meeting with different doctors to discuss this, what they consider high risk, and go from there. I have been into a few meetings so far with my preceptor, who is the lead project manager on this project, and we will be having continuing discussions, sharing what I will do, and seek her guidance on what direction does she need me to take. It's still a work in progress as my initial um, practicum site fell through because of COVID-19. This was a backup that came through, so it's still we're still figuring out some of the details. This is the link for my Protfoliogen profile. I have, in the description, I've added Health Informatics / data analyst just to increase the job perspectives. I have added a personalized headshot just to, you know, kind of personalize it, match a name with a person, and I have added a brief description about uh, myself and my background in healthcare industry. In the sidebar, I have listed my education, my undergrad degree, and the master's degree, and with the expected graduation date. My first page, I have added goals. Just I did not go in a lot of detail. Just list a professional goal, just a brief description what I want to accomplish and what I'm looking forward to do in a job. My second page is the leadership philosophy. I have decided to add this because it gives a potential employer an opportunity to learn more about you, who I am, and as a person, and what I will bring to their organization as a leader. The next tab I have in the portfolio is the documents. It lists my professional career brand plan, and also it includes the resume and a cover letter. Next, I have added a section for skills. It lists all the skills that we have learned throughout this programs. Also, I have added even though my work detail is listed under my resume, I have added a small section of work experience just to give a brief description of what my previous work experience has been. Also, I have added a page for projects, and I have embedded some of the videos that we have done as part of our projects throughout this program. I think if an employer were to look at my profile, uh, they will, easily be able to access what kind of work I have done in the past. And it's a great way to present my skills in action. Under web links, I have added a link for my LinkedIn profile. The reason I did that is because LinkedIn is one of the profiles that most employers look at. It's more popular. Even from my previous experience when I was looking for Capstone site and was contacting different people, scheduling phone calls with them, even before I would have a phone call, I would get these notifications from LinkedIn that somebody has looked in on my profile, and when I'll go and check it out, it would be usually the person I'll be having a phone call later to discuss a potential capstone project. So I think it's one of the most popular one, and it's an easy way for employers to access it from this page. My review of the Protfoliogen is that it is a good platform to show your work and have your documents all together and ready to be presented and shared with a potential employer. However, I think it is not as popular as LinkedIn. LinkedIn is the place where most employers go to look at candidates' professional profile. And I did not find it very easy to use. It took me some time to kind of figure things around on how to, you know, uh, how to make it look more professional, how to add documents, add pages, and all that. It was a good experience learning to use different tools to present my work. At this point, I would like to wish everybody good luck on their future capstone project, or if you're doing your research, evidence-based research. I look forward to hear from everybody. Thank you.